At Pacific Dermatology and Cosmetic Center, we're going to do a little Botox on our patient Katie. And Katie, can you show us the lines that we're going to treat? So you can see that Katie's very young, but she still does have, how old are you?
27.
She's only 27. But she still does have a little bit of lines here on her forehead. And then also in addition to that, she has some scars. Are these from chickenpox?
Mm-hmm.
So she has some little chickenpox scars. And Katie says that when she gets her Botox done, the chickenpox scars actually become less noticeable. And you can see she's got just sort of some faint lines. So this is about the right time for her to be doing Botox to prevent those lines from getting any deeper. And you had Botox done when last?
5 or 6 months ago.
Okay, so 5 or 6 months ago. So she's now actually able to pretty much raise her forehead entirely. So we're going to treat this area here, and we're going to use a total of 15 units. So we will wipe Katie's forehead down with some alcohol, just like this. Katie's very, very brave. She hasn't had any numbing cream or ice. We generally will use numbing cream for patients who would like to have a little bit to make it more comfortable, but you can see that the needles that we use are actually very, very small. And this is 15 units. Okay, Katie, go ahead and raise up your eyebrows. So I'm going to start just here in the middle. And I'm going to do about 1.5 actually units per site. Just kind of marching along in a V shape across her forehead. And I'm going to go up here near this little scar that she has. And raise again really big. Good job. How are you doing, Katie?
Really good.
Is it hurting much?
Not at all.
That's excellent. Go down here and do the little last one right there. And that's it. That's the end of the injections. You can see that she's got little tiny bumps on her forehead, and just like with other patients, that's due to the saline that the Botox is reconstituted in. Botox is a tiny, tiny little protein that you can't actually see. It's basically invisible. But we put it in saline in order to inject it, and then each one of those little spots will diffuse out a little bit. And in about how many days does it take for you, Katie, before you notice
4.
it? Okay. So an average is about 2 to 10 days. So for her it's 4 days where she'll notice that she won't be able to raise her forehead quite as strongly. She'll still have a little bit of elevation, and probably a little more elevation than she has right now over here on the lateral or outside part of her brows. We try to make that happen for people. And that's it. Thank you.